Utah is facing a new battle. It's been named one of the states with the highest daily COVID-19 case rates in our country. Thanks so much for joining us tonight. I'm Brian Schnee.
And I'm Amy Nay. Doctors with Intermountain Healthcare say now it is really time for people to get serious about slowing the spread so they don't have to do what some states have been forced to do, start rationed care.
Fox 13's Sydney Glenn joining us live tonight from Intermountain Medical Center in Murray. Sydney.
Brian and Amy, an infectious disease doctor I spoke with says we know how to combat COVID-19, right? We've been hearing it for almost a year now. Wear a mask, limit gatherings, social distance. He says now, though, people need to actually start doing it consistently.
Two of the highest days of cases in the last 12 months have been in the last 10 days.
Grim numbers from the Utah Department of Health, as over 300,000 people have or have had COVID-19 in our state. That's about 10% of the population.
Now we're essentially seeing what we feared.
Doctors warned about a spike in COVID-19 cases following the holidays. Now infectious disease physician Dr. Todd Vento says it's here.
We know how to stop this virus. Sadly, it's knowing it and not doing it.
There are only 3 counties in the entire state with low levels of transmission right now. The rest are in high transmission. Hospitalizations are on the rise in the Beehive State, with ICU beds about 90% full already.
We haven't done this with our practices and behaviors. We've done this with our practices and behaviors. Therefore, we've seen this with our cases and this with our hospitalizations.
New numbers from the CDC show Utah has the 5th highest average number of daily COVID-19 cases per 100,000 people in the country. And it's taking a toll, Dr. Vento said.
It's fairly much a certainty that you should expect more ICU usage, more ventilators, and more very sick patients.
More cases could be coming, Dr. Vento warns, with holiday weekends this month and next. Plus, school is back in session.
It should look unnatural to us a year into a respiratory virus public health emergency throughout the world. It should look unusual to not have a mask on.
A new study by the CDC suggests more than half of COVID-19 cases come from people without symptoms. Dr. Vento says people really need to think about that.
Assume that you have a high risk of COVID.
Again, Dr. Vento suggests the same tactics to combat the virus we've been hearing for almost a year now, because he says they work.
There's a reason why it sounds like the same thing. We really mean it. We've meant it for 11 months. We mean it really now. And we're really going to need the help of every single individual.
The Utah Department of Health reports they've administered over 100,000 COVID-19 vaccines. And while Dr. Vento says that is great, it's really going to take until early this spring for enough people to have been vaccinated that we will really see an impact in terms of hospitalizations and case counts. Live in Murray, Sydney Glenn, Fox 13 News, Utah.